Hello guys, welcome to my channel. In this video we are going to see about the external features of the stomach, then relations, then the blood supply, nerve supply and the lymphatic drainage of the stomach. First coming to the external features of the stomach. So the external features are the presence of orifices, curvatures and the surfaces of the stomach. All these three are 2 in number. That is, two orifices are present, namely the cardiac orifice and the pyloric orifice. Then two curvatures are present, namely the lesser curvature and the greater curvature. Then two surfaces are present depending upon the position of the stomach, whether it is vertical or horizontal. So depending upon that, the surfaces differ. One is the anterior or anterosuperior and the other one is the posterior or posterior-inferior. First coming to the orifices of the stomach. So the orifices, they are also called as the openings of the stomach. They are nothing but the inlet and the outlet portions of the stomach. Just I am going to draw a line diagram. Consider this as the stomach, right? So in that, in the upper portion you could find an opening through which it is connected to the esophagus, to the lower end of the esophagus, and below you could find an opening through which the stomach is connected to the small intestine, that is to the first part of the duodenum, right? So this orifice through which it is connected to the esophagus, it is called as the cardiac orifice, and this orifice through which it is connected to the first part of the duodenum, it is called as the pyloric orifice. Okay, first let us deal with the cardiac orifice. So as I already mentioned, this cardiac orifice, it is connected to the lower end of the esophagus. Now coming to the location of the cardiac orifice. See, this is also a line diagram representing the manubrium. Then this is the body of the sternum. And here you could see the xiphisternum, right? And these are all the ribs. So this cardiac orifice is just situated behind the 7th costal cartilage, behind the 7th costal cartilage at the level of T11 vertebra. See, this cardiac orifice is just situated behind the 7th costal cartilage at the level of T11 vertebra. And of course, at the junction of the lower end of the esophagus and the cardiac orifice, here there is the presence of a physiological sphincter which prevents the backflow of the contents from the stomach to that of the esophagus. There is only a physiological sphincter and there is no any anatomical evidence for the presence of sphincter over here in the cardiac orifice. Once again I am mentioning, so the cardiac orifice, it is connected to the lower end of the esophagus and it is located behind the 7th costal cartilage, 2.5 cm from its junction from the T11 vertebra. Next coming to the pyloric orifice. As I already mentioned, this pyloric orifice, it opens into the first part of the duodenum. Now coming to its location. For that, now I am going to draw a median plane. See, this is the median plane. So this pyloric orifice, it is actually situated 1.2 centimeter to the right of the median plane at the level of L1 vertebra. That too at the level of lower border of the L1 vertebra. See, once again I am mentioning, this pyloric orifice, it opens into the duodenum and during the supine position and when the stomach is empty, it lies 1.2 centimeter right to that of the median plane at the level of lower border of the L1 vertebra. So this pyloric orifice, it is also guarded by a sphincter called as the pyloric sphincter. And this pyloric orifice, it is indicated on the surface of the stomach by two structures. One is the circular groove, which is produced due to the underlying pyloric sphincter. And the other structure with which the pyloric orifice is indicated on the surface of the stomach is the prepyloric vein. So once again I am mentioning the position of the pyloric orifice. It is indicated by two structures. One is the circular groove, which is produced due to the pyloric sphincter, and the other one is the pyloric vein. Now coming to the curvatures of the stomach. Actually the stomach has two curvatures. One is the lesser curvature and the other one is the greater curvature. This lesser curvature, it forms the right border of the stomach and it provides attachment to the lesser omentum. What you are seeing here, this is the lesser omentum. Lesser omentum is nothing but the peritoneum attached to the lesser curvature of the stomach. And here you could see the greater curvature of the stomach, and to which the greater omentum is attached to the stomach. So this greater curvature, it not only provides attachment to the greater omentum, but also it provides attachment to the ligaments like the gastrosplenic ligament, which is attached from the stomach to that of the spleen, and the other ligament is the gastrophrenic ligament, which is attached from the stomach to that of the diaphragm. There lies presenting features for each curvature. So the presenting feature of the lesser curvature is the presence of incisura angularis, and the presenting feature for the greater curvature is the presence of the cardiac notch, which separates it from the esophagus. So this cardiac notch, it separates the greater curvature from the esophagus. Here you could see the cardiac notch in this space. So this separates the greater curvature from the esophagus. Then coming to the surfaces of the stomach. So the stomach has anterior surface and posterior surface, or anterior superior surface and posterior inferior surface, depending upon the position of the stomach. Let me explain it. So when the stomach is vertical, it has two surfaces. One is the anterior surface and the other one is the posterior surface. And if the stomach is horizontal, which is the common position of stomach in obese persons, so if the stomach is horizontal, then the stomach has two surfaces. One is the anterior superior surface and the posterior inferior surface. So see, this is the anterior surface of the stomach, and here you could see the posterior surface of stomach. And here you could see the entire stomach is covered by the peritoneum, and the peritoneum attached to that of the lesser curvature, it is called as the lesser omentum, and the peritoneum attached to the greater curvature, it is called as the greater omentum.